Hello everyone, so my CT scans are here. We have a full queue from the emergency. Let's grab an exam and report it from the clinical history all the way to the actual report. I'm going to share my screen so you guys can see the images. I have already chosen a exam. Let's see. We have a CT scan of the lumbar spine. This is a 72-year-old male patient who says he has intense pain, lower back pain that irradiates, that goes to the inferior limbs. The paper the doctor sent to the clinic asking for the exam to be done. It says it should be contrast enhanced, which makes no sense. We don't do contrast enhancement on CT scans of the spine because they make no sense to be enhanced. So this is loaded. We have here a axial volumetric acquisition. This is great because we can do MPR reconstructions and actually look at every single detail on this patient spine. You guys have already seen we have trouble here. We have a lot of degenerative signs. This isn't a normal spine. This patient has all the reasons in the world to, or in his spine, to be feeling awful, to be in an awful state of pain. So we have here, this is S1, this is L5 because this is the last rib. Let's follow this rib until we get D12. So this is D12 and this is L1. So let's count 1, 2, 3, 4, and 5. There is no transitional vertebra. This is L5. So this is 4, 3, 2, and 1. And this is S1, the first sacral vertebra. So let's grab a template because no, I have templates. Work smart, don't work too much, so we can actually make some money. So let's go through. First of all, on the lumbar spine, we can look for fractures using a bone window. Excuse me. So as you guys see here, I have a fracture, a chronic fracture with pseudoarthrosis of the isthmus, of the articulatory process of both L3 and L4 on both sides. So this is spondylolysis, which means fracture of the spine. So this is a very common degenerative fracture which leads to instability and more degenerative disease. These joints are unstable, so they are on both sides unstable. So these segments from L3 to L5 are unstable segments on the posterior column of the vertebral spine. This leads to, of course, pain and other degenerative diseases, including disc herniations, which are very much present here, very much present. So we have spondylolysis. I'm going to type that in on the report. Also, just before that, I can see that all the general density of the bone is fine. There is no severe osteoporosis, as much as we can tell on a CT scan. I can see L5 is a bit dislocated backwards over S1, so we have a heterolisthesis, a posterior dislocation of this vertebra in comparison to S1. We have to report that also. And we have osteophytes on the anterior portion, on the lateral portion, and on the posterior portions of the end plates of the vertebral body. So this is marginal diffuse osteophytosis. So we have to also describe that. We have some sclerosis and some bone cysts. This is all degenerative disease of chronic disc disease. Let's go. There is retrolisthesis. This is of the first degree. Yep. Type in. The vertebral bodies have normal height, but they have these degenerative signs, which I'm going to describe now. We have normal heights and marginal osteophytes, sclerosis, cortical irregularities, so we have that. Also, you guys can see here there is reduction, decrease, intervertebral disc spaces with accumulation of gas inside the disc on the approximate site of the nucleus pulposus, which is Latin for the core, adipose core, gelatinous adipose core of the disc. This is a end-stage degenerative disease of the disc, so this must be reported. The other segments have also some degree of degenerative disease, so this is chronic degeneration of the discs. And we also have thickening of the ligamentum flavum, which are the yellow ligaments. As you can see here, they are thickened and they kind of bother the dural sac right here. So this is degenerative. This is from overload of the spine and old age, and this contributes to symptoms, so we must report it also. It's already here on my template. And of course we have those fractures with pseudoarthrosis, which are spondylolisthesis, and we have a moderate case of facet joint arthrosis. So let's go. There is hypertrophy, there are osteophytes, and there are reduction in the interarticular space, and also subchondral sclerosis. So this is classic arthrosis, moderate because there is already some degree of deformity. This isn't just mild, this is moderate. So let's go. I have done that. I'm just going to report the spondylolysis. And there are now the main course of this exam, the thing that you guys are waiting for, which is the 3 disc herniations on L3, L4, L4, L5, and of course L5S1. Right here, let me just window this properly so you guys can see. I can see even on bone window because I'm used to it. There is a disc herniation right here. There is a disc herniation right here and a disc herniation associated with the heterolisthesis right here. So this is major. This a diffuse bulging disc. This is a protrusion, is a diffuse bulging disc, and this is also a diffuse bulging disc. This is all over the place. So on L3L4 there is some degree of compression, some mass effect on the dural sac. On L4, L5 this is greater, more prominent, and of course on L5 S1 there is moderate stenosis of the dural of the vertebral canal, the vertebral foramen. This is mild, this is moderate, and this is normal, even though there is some mass effect over the neural structures. This is plain normal. So let's see now the intervertebral foramina. On L3, L4, even with the herniation reaching the foramina, we don't have a stenosis per se, but on L4, L5 we have mild stenosis because there is disc and other structures touching two sides of the nerve roots, and in this case we have a compression and deformity of the nerve roots by bone, ligament, disc, herniated discs, and all this good stuff right here. This is trouble, this is severe pain, and even requires surgery sometimes. So there is very severe disease on L5S1, mild to moderate disease on L4, L5, and a very mild disease on L3, L4. So it gets worse as we go down towards the sacrum. So let's just report this very particular and painful disc herniation. So there is a protrusion on L3, L4, wide base that reaches the foramina. And now for the next two segments, I'm going to make it the same description because this is the same disease, so one stage worse on the lower segment. So segments L4, L5 and L5S1. This is a diffuse bulging disc with a extruded component, posterior extruded component that occupies both the vertebral canal and the neural foramina, the intervertebral foramina. So there is mild stenosis of the vertebral canal and the foramina in L4, L5, and moderate stenosis of the canal and severe of the foramina on L5S1. So this is probably a surgical case, even though this patient is quite old. Sometimes old age will be a factor to postpone this surgical intervention or even not consider it viable. So there is also a very prominent sign of chronic denervation of the perivertebral muscles which is justified by the chronic nerve root damage caused especially by this complex herniation. Right here there is hypertrophy and fat infiltration of the perivertebral muscles. So this is a very painful, very severe disease on this old man, this 72-year-old man. So this is already here on my report, because I grabbed a template for old people's severe damage lumbar spine. Let me just review it and summarize this report. So if you enjoyed this video, I'm pretty sure you're gonna enjoy this one right here. Just click here and watch the next one. Please hit the like button and consider subscribing to the channel. And of course, if you may, just share this video with people you know enjoys diagnostic radiology. Thank you so much, and until next time, I'll see you on the next video. So long.